Welcome everyone. Welcome to Casual Conversations, our 8th show. I am so happy that you decided to come, and everyone has been giving us such great feedback. So we're going to keep doing this. You guys are the first to know we have next week on February 11th, Karen Mason and Paul Van Donkler, I always mess up his name. They're having a domestic violence conference in February, and they're going to come talk about that. And then Willie Stewart's going to come from Glasgow in February 18th. And then Hugh Williams from Exeter will be on February 25th. And then we're going to have Catherine Iverson and Tara Glofsky from the VA come speak. So we've got a great next 4 weeks. So I appreciate you guys spending time with us today. And this is the Casual Conversations, which came out from the Brain Injury Professional magazine, Women versus Brain Injury. This is published by NABIS and IBIA, and they host the program. So very grateful to them. So I'm very excited today to introduce my guest, Dr. Ortiz. Hello, Dr. Ortiz.
Hi, Catherine. Nice to be here.
Thank you for coming on the show today. So before we get into the topic, the endocrine system dysfunction after TBI, let's start out light with a little bit about you. Tell me where you're from.
Yeah, that's always a funny, hard question. I'm Bryce Ortiz. I'm from Arizona, and I am still here. So I went to grad school at Arizona State University, and then I'm currently a postdoctoral researcher at the University of Arizona in the lab of Dr. Rachel Rao.
When did you start become interested in brain injury? How did you end up here?
So after my grad school experience, I kind of wanted to get some work that was more, that kind of sounds bad, but more translationally relevant, and then also kind of dip my toe into clinical work. And so I was lucky.
What kind of work were you doing before?
I was doing work on chronic stress and how that impacts the brain and behavior. And it was mostly preclinical. So we used rodent models of depression. We stressed them and then looked at how the morphology of cells in different areas of the brain changed and how that corresponded with the behavioral changes that we saw. And then my specific work was looking at how those rats could recover from a period of chronic stress. And so we stressed them, looked at brain cells, but then if you let them have this time off from stress, they show this kind of remarkable recovery. Their brain cells return to normal and their behavior looks normal as well. And so following that, I was just kind of interested in other types of brain insults that that we could look at to see how individuals can recover from those as well. And so I was lucky to be introduced to Dr. Rao by one of my close friends, and then we just went from there. And now I work in her lab.
That's great. So what have you been working on the last couple of years there?
Yeah, so my main work looks at brain injury in the pediatric population. A lot of it still involves rats. So we use juvenile rats and injure them and look at endocrine dysfunction. And then we're also interested in how the endocrine dysfunction also maps onto changes in the sleep-wake cycle. And so that's my primary focus. And then we do other things in the lab as well, looking at like inflammatory markers and a lot of the sleep work that we'll talk a little bit about, I think.
And I think just for those that aren't familiar with pediatric brain injury, just use my hands, just a raw kind of look. So if this is the normal development of a child, and it's curving upwards, if you have a child with brain injury and they're injured here, they plateau or may go down. And even if they recover, they're still going at a level lower than they would be without the brain injury. And it's that differential. It's just so key to help children with pediatric brain injury as soon as we can, and to look at all different types of things we can do to help them. And I think the endocrine system disorders are in a way not good news, but it's actually the part of the brain injury we actually can and have treatments for, right?
Exactly. Yeah. I mean, that's, um, I mean, you captured it really well. It's that these endocrine problems can happen in childhood, but they're really easily treatable as long as we recognize that they're actually occurring. And so that's, I mean, one of the calls, I'm probably jumping ahead here, but one of the calls in the paper that we're talking about today is just to keep in mind that endocrine disruptions can occur following pediatric brain injury, and that clinicians and other caretakers should just be aware and watch out for those types of changes.
And I think the bottom line is if you find these things, there are drugs to actually fix them. Like it's a fixable thing, unlike
Yeah.
many other aspects where we're trying to put accommodations around it. We actually can work and cure these disorders.
Yep, exactly, 100%.
So that being said, okay, so let's talk about this specific paper. Where did what led up to starting this paper?
Yeah, so to be honest, it was started a little bit before I arrived in the lab, but I think it was the other co-first author on the paper who had, she was a med school student, and so she had I forget what they're called, but a med school project that they have to do. And so they work with researchers in the Phoenix area to come up with these projects. And she was interested in just looking at endocrine disruption in a pediatric population. And so she got access to some data from Phoenix Children's Hospital and looked at that as like a first step to see whether there were endocrine disruptions in children following brain injury. And then we were allowed access to a larger data file. I'm sorry, I just cut you off.
Oh, no, so I just want to say, so this is actually a really unique thing that she's looking at. We do know endocrine disorders happen in TBI in adults. I know from the VA, usually they wait a year after a TBI of a soldier or service member to do a complete endocrine panel, because they know that for a year, all the hormones are going to be just thrown off. So it's part of the military protocol to look at hormones. So it's part of the adult view. And so her thought about what's happening in pediatrics was pretty much a very unique question. True?
Yeah, I think so. And I don't know if there's like a standard protocol, and I don't think there is, for assessing or looking at endocrine disruption following brain injury, or if it's always included in a doctor's like follow-up following brain injury. And so that was part of the big takeaway from this from this paper, is to make sure that it's something that is followed up on in the clinic.
And so you got access to a smaller database, and then it was expanded out?
Yeah, and so then we were able to have access to something called Access, which is the Arizona Healthcare Cost Containment System. It's the form of Medicaid for people in Arizona. And so it includes a lot of children. And so we were able to have access to that database, and it provided over 600,000 individuals with a brain injury over the span of 5 or 6 years. And then we were able to ask questions based on that large database. And so our main question was, how many of these individuals who had a brain injury were later seen for some type of endocrine disorder?
And what did you find out?
Yeah, so there were about 500 cases where out of the 600,000, where individuals that had a brain injury later came back for endocrine type disruption. And so following that, we kind of teased it apart a little further to look at age after the amount of time following injury to the endocrine disruption. We also looked at the age that the endocrine disruption occurred, and then the gender differences in the individuals that came back for those issues as well.
Now, before we break those down, let's talk about what an endocrine disorder would look like in a pediatric case.
Yeah, so endocrine disorder is kind of this broad classification, really. And it's basically anything that where you have a problem with hormone regulation or release, right? And so it's yeah, it's really broad. So it can look like many things. So the most prominent endocrine disorder in our database was something called precocious puberty, and then also something called growth hormone disruption. And so those individuals had an issue with either the release or the regulation of a hormone called growth hormone. And yeah, hormones are really important. Sometimes I feel like that teacher on the Adam Sandler movie where he's like talking about the medulla oblongata when I talk about hormones, because it sounds really boring, but hormones are super important for just daily functioning. And kind of an interesting thing is that they're mostly controlled by these tiny areas in our brain that sit at the base of the skull. And so because of the location of those brain areas, we think, at least I think, that they could be easily damaged following a pretty mild, even brain injury. And a lot of studies are starting to show that even mild cases of brain injury could lead to long-lasting endocrine disruption.
And do these disruptions happen, the next day after the brain injury, or 2 weeks later, or 2 years? Were you able to get an idea from these diagnostic codes? Again, you're retrospectively looking at medical records, when these occur and what age children were most vulnerable?
Yeah, so we excluded any individual who had been seen for an endocrine disorder before, because we didn't want it to be like a previous endocrine dysfunction and not as a result of the brain injury. We also excluded any individuals who presented for an endocrine disorder before 6 months after the brain injury. So the inclusion criteria was that individuals had to have a brain injury, and then 6 months had to pass before they were brought into the clinic for an endocrine disorder. So we were trying to look at more of it's not even long-term, but just to make sure that it was a brain injury-induced endocrine disruption and not something that was already there. And so, yeah, they can, I don't know how quickly they can occur, but a lot of times they could be long-lasting. There was a paper that we just discussed in our lab meeting recently, talking about how these endocrine disorders can either flare up or just remain present for at least like 10 years following an injury in the adult population. And so that's one of the other critical parts of this paper, is like there's not that much known about what happens in pediatric populations following brain injury, at least in terms of hormone disruption.
Yeah, I think I poorly phrased my question. It was more like, what was the gap between the brain injury and finding these endocrine disorders? That in some cases it was a couple of years, true?
Yeah, so this is where I would say cue slide, but there is this
slide. I secretly have a slide.
There's one of the figures on the paper that explains this, and it's one of the colored ones, and it's showing the gap in time from when males and females are diagnosed with a brain injury to when they're diagnosed with an endocrine disorder. And what we found is that females have this shorter span of, right here, the red where your mouse is.
Or did you want
right
that
below?
one?
Oh no, the other one.
Okay.
Yeah. So sorry, the time gap in years, it's panel C. And so the time gap in years following injury. And so what this figure is showing is that it's split up by males and females, and it's looking at the time between the brain injury and then when they presented for an endocrine disorder. And what you can see is that there's this kind of ballooning effect for females, where they show this more prominent endocrine diagnosis following brain injury in about a year after the injury, compared to males, where it's kind of spread out.
Which would be right
this
here.
like time gap. Exactly. Yeah. Yeah, I was pointing to it with my mouse, thinking that everybody could see that, but I realized nobody can. Yeah. So yeah. So the time gap in years from when a female is diagnosed with a brain injury to when they're diagnosed with an endocrine disorder is shorter in females than it is in males, and that's what that figure is supposed to be showing. Yeah, and so this is I think it's a great figure, but it kind of sums up the study really well. And in the middle panel is kind of an answer to your other question. We have the females represented in the red line and the males represented in the blue. And what you could see is that females show this endocrine dysfunction following brain injury around the ages of 7 to 11 years old, which interestingly enough is also the time when females typically undergo puberty. And then if you look at the males, their peak of when they experience these endocrine disorders following brain injury is around 11 to 15 years old. And that's also when males experience puberty. And so it's kind of interesting to me that it's around these time points that we're seeing the biggest increase in endocrine diagnosis. And that can be because, maybe puberty has started and we're starting to see something odd going on with the children, or, maybe there's a delay in puberty as well, or puberty happened too quickly, which I said was one of the most prominent diagnoses we saw following brain injury in these children. And then the figure on the very left shows that females were more likely to be diagnosed with an endocrine disorder than males were, at least in our sample population.
That's really interesting. And it's interesting too, when in the middle chart, the black line, how when you don't look at sex differences, how it evens it out into something that's really not helpful for either sex.
Exactly. And that's what we were showing in that first figure that you also had pulled up, is like when you look at the incidence just combined, the age at which they experience these endocrine disorders is like 7 to 11. But from the other figure, we know that this is mostly carried by the females in our study population.
The females are carrying it here and the males are carrying it here.
Exactly. Yep.
Interesting. That is fascinating. And then at these lower ages, there still was issues. This isn't necessarily a teenage problem. This is something that you're seeing, before 4 years old. It does exist.
Exactly. Yeah. And that's part of it is one of the other prominent diagnoses was the growth hormone disorder or disruptions that I also mentioned. And that hormone's pretty critical throughout the developmental ages. And so I don't know, just thought I would shout that out because that's a lot of the work I'm doing in rats now is looking at growth hormone disruption following pediatric brain injury.
That is really fascinating. Let's see if I can unshare. So what was the biggest surprise for you based on you thought you would find this since you found it in adults? So you found what was the surprising takeaway for you?
I think that it was as prominent as it was. So we found that children that suffered a brain injury were 3.22 times more likely to be diagnosed with an endocrine disorder than just the general population. And I thought that was a pretty, big effect. And also that, I don't know, there were these like massive gender differences that we saw in the patients as well, and about the age range that they occurred.
Yeah, and I think that's the Annie was on, and she is a researcher up in Canada talking about it's not just gender or sex, it's not just sex, but it's age and sex. And that combination of those two are really important to understand what's happening for girls at what time frame and what's happening for boys at what time frame. And if you just look at time or you just look at gender, you're going to miss that cross section because humans aren't the same chemistry isn't going on when you're 4 as that when you're 14 as when you're 24. And
exactly. Yeah.
Right.
Mm-hmm.
I do see some questions. I did one of the stats I pulled out of your paper that it ended up being about 1 in every 150 patients, 150.19 patients that overall that you found the endocrine system dysfunction after TBI.
Yeah, so that's we calculated that relative risk, and that just tells you if you have a sample of individuals that are diagnosed with an endocrine disorder or traumatic brain injury, how many of them are likely to be diagnosed with an endocrine disorder, and then you could calculate about how many you would need of that sample population. So how many brain injury victims would you need to find at least one patient that would develop an endocrine disorder? So yeah, it's like one out of every 159 will probably, based on our sample, develop an endocrine disorder.
I did want to point out that in the brain injury Professional Magazine. The paper is on page 26 is the article. And the paper, can you just say the name of the title of the paper? Because some people didn't have the link. The email that was sent out about this did have a link to your paper, but can you say the name of your paper for the people that
Yeah.
up?
So it's in Frontiers in Neurology, and it's called Epidemiology of Pediatric Traumatic Brain Injury and Hypothalamic Pituitary Disorders in Arizona. And hypothalamic pituitary disorders are just endocrine disorders. We just call them that for honestly to appease a reviewer, but yes, hypothalamic pituitary disorders are endocrine disorders.
And I'll put that in the chat while you're doing the next section. I will go cut and paste that from the other place. The other thing I wanted to talk about is what were the limitations of this study, and then what do you want to do next?
So the limitations are probably the way that the codes. So in this paper, we pulled these things called Icd codes, and they're international classifications of disease codes, and they're basically what a doctor inputs into a computer when they diagnose a patient with whatever disorder they're diagnosing them with. And in that, it's not as specific as we would like it to be. So it's not really, we're not able to see like the clinical notes or even how severe a brain injury is. And so that was probably one of the biggest downfalls is, does it matter if it's a mild case of brain injury or a moderate, or does it have to be really severe for these endocrine disorders to appear? Yeah, there's a few others. We're talking about like a Medicaid population database, and that could lead to some confounding variables as well. Yeah, I mean, I should just say that I think it's really great and there's no problems with our study at all.
Well, I think it's fascinating that the study was done, and what's the next wave that you'd like to see? Are you taking this paper in another direction? Do you have another aspect? Like what's fascinating? What fascinating thing are you doing right now?
Yeah, what's really cool about I feel like the lab that I'm in is we're able to work with these clinicians at Phoenix Children's Hospital and then kind of take back these findings back to the wet lab, the rodent lab, and kind of manipulate some things to try to get at a more detailed question, I guess. And so what we're interested in now is what are the brain mechanisms involved in leading to these endocrine disorders following traumatic brain injury. And so a lot of this work looking at endocrine dysfunction following brain injury in adults or the pediatric population is just in a clinical population, and they can't really say definitively what's causing these issues. And so, like I said, there's these two really small brain regions that are mostly involved in producing hormones. And so what my question is now is to bring this back to the lab. We're looking at pediatric or juvenile rats, and then we're injuring them. We're looking at hypothalamic neurons and how they can affect the release of certain hormones. And then we're also looking at problems with the pituitary as well. So just looking at these two specific brain regions, what you can't do in a clinical population, and just kind of trying to tease that apart a little bit more to see if we could get at the root of what is causing these endocrine disorders following brain injury.
And then for any lay people that are on the call, how is an endocrine disorder identified by a doctor? What test is needed?
So a lot of times they have to do like stimulation testing, because hormones are on this, depending on the hormone, they're on this cycle, just like all of us are. And a lot of them have this diurnal cycle, so they fluctuate throughout the day really heavily. So growth hormone, for example, shows this really high release during sleep, but it kind of goes down during the day, but it fluctuates a lot throughout the day as well. And so they have to stimulate growth hormone production somehow. And so for growth hormone, at least, they do something called like a glucagon test. So they give this other type of hormone or peptide that can then stimulate the production of growth hormone to then measure it in the blood. And then there's other tests for different hormones as well, but usually you have to stimulate it somehow.
But there are tests to determine definitively whether somebody has an endocrine system dysfunction or not.
Yes, for the most part, yeah.
Which is great because there are things out there that we don't have measures for. So we have measures for the dysfunction, and then there are treatments for actually the issue at hand, which we don't often have in brain injury, something that's that definitive with something to help it. So
exactly, and that's what you were talking about in the beginning of the conversation, is really that these endocrine disruptions are really easily treatable. So if we know that they're happening, we could just go in and give a drug or administer something that could reverse the detrimental issues that these hormone disorders are causing.
We definitely are getting a lot of questions, and I know you and I could keep talking. So let me just look at a couple of them. One of the questions was, is dysautonomia, I have trouble saying that one, and an endocrine order different or part of the same thing?
Let me get my Google out real quick. I don't actually know what dysautonomia is.
I think that's
maybe I have to see it spelled.
I think it's vestibular based. I think that's a vestibular based issue. So hold on that one.
Okay.
Where does it matter? Does it matter where a girl is in her menstrual cycle at the time of the TBI and a recovery trajectory? That's Jeff Bazarian's work, but go.
Yeah, no, that's a really good question. I feel like that's a big question to be answered. And I know some people are doing it like you were saying. We don't know for this study at all what an answer to that question. And while those hormones are really important, we're focused on like growth hormone and a couple other sex steroid hormones. But yeah, that's a really important question as well. But I'm going to let other people answer that one.
It's a great one for the NCAA to be working on that with all the other things that they're working on. I've kind of been pushing for that for a couple of years.
Exactly.
Question from Facebook Live. What endocrine disruptions are common in adult women? This is someone who's 56 and ignored the impact of her head injury, which symptoms related to thyroid or menopause. You were just working in pediatrics, right?
Yeah, but I do know that I've really mentioned growth hormone a lot. Can you tell which my favorite hormone is? So in the adult population, at least from what I've read, is that the highest, the hormone that's usually affected by brain injury in adults is also growth hormone. But that's not to say that all these other hormones aren't affected as well, especially if they're controlled by some of the same brain regions. You could imagine that all the like estrogens and different types of hormones are affected as well. I don't know specifically for, it sounds like they're mentioning estrogens. I don't know necessarily in adults how that's messed up. And we usually use pre-pubertal rats, and most of the kids in our study were also pre-pubertal, so I don't know exactly.
Well, I wanted to open it up for a conversation. There's so many questions. We can go back to the questions in the chat, but does anybody want to unmute and ask Dr. Ortiz a question to start a conversation? Come on, there's got to be a question out there. Anybody? Lisa, are you speaking? You have to unmic.
I have a couple questions.
Hi,
I'm Malika Gormally with Concussion Alliance. Two of them. One is, did your study segment by severity of injury because of mild TBI being quite different from moderate or severe? And the other question is, I'm familiar with blood tests for growth hormones. Is a challenge test different, and are physicians going to miss a problem with growth hormone if they don't do a challenge test?
So for the first question, we tried to, and So with the hospital data that we had, we were more likely to look at whether the injury was mild or severe or moderate. But for the big database that we had, the Access database, we weren't able to tease those apart. It just, the ICD-9, the codes weren't put into the database as well as we wanted for us to be able to pull those things out. And then for your second question, yeah, I think a lot of hormone issues would be missed if we just look at blood at the one time that they come into the clinic. And that's what I was talking about with the diurnal fluctuations. This happens with almost every type of hormone that we look at, that there's these giant fluctuations in hormone release throughout the day and throughout the night. We could look at another one like cortisol, for example, is relatively high throughout the day. It decreases about the time we're supposed to go to bed. It's really low when we're asleep. And then about the time we're starting to wake up, cortisol like jumps up really high. And so if you're just looking at cortisol when they come into a doctor's office, you're gonna miss something about how cortisol is regulated, for example. And in the case of growth hormone, the highest point of release of growth hormone is during like deep sleep or slow wave sleep. And so if we're not like stimulating the release of growth hormone, we're gonna miss kind of what the typical level of growth hormone is when it's most highly released. So yeah, I think it's important for like stimulation testing. I know that I was reading that some, at least back in the day, there were some issues with how whatever drugs were administered to invoke the hormone responses, like it could cause other like off-brand issues that they weren't hoping for. But I think maybe most of the time it's relatively safe. I don't know. I know there's probably some MDs on this call, so they could probably answer that better than me. But yeah, I know it's important, at least, especially in like rats, for example, to like invoke a response in growth hormone or hormone release to make sure that we're seeing what the system's actually able to produce.
And I think Lisa,
Thank you.
Lisa, did you have a question?
Yeah, I did. Thank you. I didn't have my mic unmuted.
I saw you.
I was wondering, with child neglect and abuse, is that the same? Do they experience the same endocrine complications as what did your study? I guess that was for like a concussive type of injury.
Yeah, so great question, and thank you. It's a really important question, and one that I'm really interested in is looking at abusive head trauma and how that affects children as they develop through their developing years. This study actually got started from that med student that I talked about, Alona Sukina, who's now a fellow at Phoenix Children's Hospital. But she, in one of her first looks at the data, she found this case of these two boys that were brought in, and they suffered from an abusive head trauma. And the interesting thing is they were twins. And so what happened was one of the twins stopped developing at the same rate as the other twin. And so they brought that twin in and they tested him for these different hormone problems. And it turns out he had this huge growth hormone deficiency. And so once they started him on this, treatment regimen, he greatly improved. And so it's probably the case that abusive head trauma or different types of abuse can lead to these really severe problems with endocrine dysfunction. But it really just comes down to, the individual mechanisms of whatever brain trauma is occurring. I know there's a lot of papers now. A researcher in Utah that I can't remember her name, she just recently published a study looking at really mild cases of injury, like mild concussions, and found that endocrine disruptions can occur from even like mild concussions in the pediatric population. So there's a big span of if it's mild or if it's very severe and how that can affect like hormone production and release. So yeah, I think I missed the second part of your question in answering, but great question, thank you.
Thank you.
Any other questions out there? We peaked at 100 people. That was our max, Dr. Ortiz. So people were very interested in the topic. I'm sure there's some more questions out there.
I have a question,
Sure.
Catherine. I was wondering if you have any awareness of the long-term consequences of these endocrine disruptions, particularly for girls, in relation to whether it's anything from mood, psychiatric, to fertility, to different long-term consequences that could come, especially if it's not diagnosed early or treated.
Yeah, so I mean, that's a great question as well. So we don't know from our like specific cohort of patients that we had. We didn't follow anybody to see how they function throughout the rest of their life. But I know there are a lot of studies looking at hormone disruptions and how that could lead to these long-term effects. And a lot of it is there's these issues with developing cancers in childhood and early adulthood from having these early endocrine disruptions. There's even there's a lot of behavioral changes. One thing that we also started looking at, we wrote a book chapter about it, is how puberty is disrupted following these endocrine disruptions. And so if you have like early or delayed puberty, this could lead to a lot of like social issues or growth issues as the child continues to develop into their teenage years. So it can lead to a lot of issues, a lot of problems. And then there's also times where it doesn't happen at all. So a lot of endocrine disorders can also spontaneously correct themselves, and they'll be fine in a few years as well. But that's the whole point of like the study, and probably what we're talking about today, is just to make sure that we keep in mind that endocrine disorders can happen following pediatric brain injury, and that we need to check them and make sure that everything's okay. And then if there is some type of endocrine disorder, then treat it. And it's really easy to treat these types of issues.
Great question, Cara. Elaine, do you have a question? Yeah, I wanted to get to you.
Eliane, may I? Yeah, hello.
Hello.
My name is Eliane. I'm from Brazil. I work at SARA network of rehabilitation hospitals. I work here for 23 years now. Today I'm completed 23 years, and my master's degree is on traumatic brain injury in kids, in children and teenagers. Specifically, I am evaluating the hypothesis on magnetic resonance follow-up. Okay, and we at SARA, now first of all, congratulations for this wonderful work. I'm very impressed, very excited about it. It's something that I'm really interested on it. We have lots of girls and boys, since babies to 18, 20, 30 years old or more, okay? And we started a protocol that as soon as the patient comes to rehabilitation, we do the hormones, not the stimulating tests, okay? The general hormones, and every 6 months we do them too, okay? And we find up to 30% of hormone problems, many times, not all of them with clinical results, but many times we have patients with pan-hypopituitarism that we start treating, okay? And my master's is specifically, I'm evaluating the hypothesis on magnetic resonance. I took their brain injury hypothesis and I'm measuring them, and I'm seeing that with time, they are getting smaller.
Mm-hmm.
So
what area of the brain? Just total
hypothesis. I have the radio. I'm a pediatrician, okay. But okay, so when the radiologist looks at the magnetic resonance of the brain, he doesn't look specifically at the hypothesis. Only if I ask them, oh, this patient, I would love you to see the hypothesis. So I learned how to measure, okay, because I'm a pediatrician. I would like to know what's happening with this magnet. And I have 100 patients. 100 patients did the magnetic resonance. No one needed sedation. We have a very special people that make them to be quiet, okay. So no problems for no radiation. And about 30 patients, I have 3 exams every 6 months.
Are you getting, she's freezing up?
About 15, I have 2 tests. Population, I'm finding about comparing to results in normal children. Okay, I'm seeing them shortening with time. The hypotheses are getting smaller with time. So this
Yeah.
is my master degree. That's I hope this next month I will be writing about it. Okay,
Yeah.
and after we want to know why if it's immunological. So we are studying apolipoprotein A, gender for sure. The girls are worst. So it's a very beautiful what you are doing, and we hope that we can contribute to. Okay, we didn't do these tests because of endocrinopathies. We thought that we could use the treasure that we had already in the system, and we are digging, and we are finding very interesting things.
Yeah,
Soon we will
that's
be
amazing.
releasing this.
Yeah,
I'm very happy because. Nah,
Yeah, I want to email you so that we can continue this conversation
yes,
too. 'Cause
let's
that's
talk
really
about.
cool.
I think you have lots to. Yes, thank you very much.
That's great.
Yeah, thank you.
Congratulations, a beautiful work. Thank you.
Thank you.
Thank you for, could you mute because there's background noise, but I want to make sure you guys connect, and you can email me and I'll make sure you guys connect. Thank you. Any other questions? We have maybe, 3 more minutes.
I'd like to ask another question, please.
Sure, Lisa.
On cortisol levels for pain, I guess pain issues, do you find that the brain injury could create cortisol disruption to where pain levels are higher and constant? Do you have any opinion on that or information?
That's a good question. I don't know exactly about how in like clinical population, how cortisol is affected following brain injury. I know that it exists. I know that that's an issue. We looked at some like cortisol dysfunction in rats. It's called corticosterone. We looked at corticosterone in rats following brain injury, and we find these significant changes following brain injury to the cortisol functioning. But I don't know about pain, and I don't know how it exists in the clinical population, but I would assume that if there is this cortisol dysfunction, it could lead to the issues that you're describing, but I don't know exactly. But yes, that is a good future direction for our research as well, because cortisol is really important.
Right. Does that relate to inflammation markers as well?
Yeah, I mean, cortisol definitely has a relation to inflammatory markers. A lot of the work we do with inflammation just looks at the strict inflammatory markers, not necessarily how it corresponds to cortisol. And so our lab is all kind of interested in how inflammation following brain injury, how that occurs, and then also how that can lead to changes in the sleep-wake cycle as well. And so it's a little bit separated from the cortisol questioning that you're asking, but yeah, inflammation is a big issue following brain injury.
Okay, thank you.
Mm-hmm.
I'm just reading through some of the questions. Is there any other questions from the floor? Someone asked, do I need to see a neuroendocrinologist, or can a regular endocrinologist diagnose these disorders?
Oh, good question. Is there a big separation between neuroendocrinologists and regular endocrinologists? I don't know, but I would assume that an endocrinologist can diagnose these disorders very well, especially a pediatric endocrinologist.
I see Hirstein here. I wondered if Johnny was here, because Johnny was also on this paper. Johnny, if you're here.
Yeah, Johnny was here. He might have left, but he was here earlier.
Let's see. Call him in. It's great.
No, I'm here. I'm listening to Bryce. He's one of our rising stars in our program, and thrilled that he's taken this under his belt as his main focus.
Do you have any comments you'd like to add about the paper? And Johnny was one of our first for our first casual. He was the first casual conversation before we knew what we were doing. So appreciate you coming back.
You're welcome. And Catherine, these are great conversations. The main comment is that research is hard. This project, which Bryce didn't tell you about, started 6.5 years ago, which when you think about it, it shouldn't take that long. Like the data were in the system. We should just be able to extract it and analyze it. But it does require certification and approval and compliance in order to be able to get those data. And the other challenging part is that this project represents an intersection of two different disciplines, neurology and endocrinology. And the funny anecdote at the beginning of the story was we asked our neurologists how many of their brain injured patients have endocrine disorders. And they answered quite simply and frankly that I'm a neurologist, why would I even think about that? And then when we went to speak to the endocrinologists, they said the exact same thing in the reverse. Why would we consider it to be a neurological origin? We're endocrinologists. And so what I'm most excited about is the fact that this sparks conversation between endocrinologists and neurologists. And sometimes the result of research is not necessarily to have an immediate impact, but just to start that conversation. And so what Bryce has been articulating is the idea that brain injured patients or parents of brain injured children can really come forward and ask for and push for endocrine diagnoses if they're concerned. And Bryce articulated this case of twins in Phoenix that was just remarkable. I mean, it was basically a gold mine to be able to watch two twins, one that had inflicted trauma that didn't grow accordingly. And so we're excited about not only future clinical research to answer all the questions that are come up in the chat, but also the laboratory research that will get at some of the mechanisms moving forward.
Thank you, Jonathan. And there are two things I wrote on my notepad to get to, and we're sort of almost at the end of our time, was we wanted to talk a little about sleep, and we wanted to talk about shaken baby, which reminded me from the twin story.
Have a helicopter going over.
Okay.
There we go. Okay, sorry, it was really
I have
loud.
a quiet dog that decided to be loud. I've been
Yeah.
shooting pens over at my dog to be quiet, and that's why Bryce was laughing because.
Yeah.
Anyway.
So yeah, I don't mean to do this or throw my mentor under the bus, but I think that if we really want to talk about sleep issues following brain injury, you should invite her to have one of these casual conversations. Dr. Rachel Rao, she has a lot of experience in sleep following brain injury. She was on here, but I know she's really busy today, so I'm not sure if she's still here. But she does a lot of work on brain injury and sleep. And so some of the work that we're looking at is in rodents, like I said, and what we see is there's this period after brain injury where rodents sleep a lot more compared to rodents who don't have a brain injury. And so we think it could be some type of protective mechanism following injury that allows the individual to try to recover from this initial insult, which is kind of funny because if you think about like the old wives' tale, I can't think of a better word for that, of when a child has a brain injury, you're not supposed to let them sleep because they could slip into a coma or something. But it's possible that the sleep following injury is actually beneficial, and it's starting to help correct some of these inflammatory markers or issues that we're seeing following the initial insult. So yeah, and then some of my work is looking at sleep following injury. The data are really preliminary, but we're looking at the different stages of sleep, looking at non-REM sleep, non-REM sleep, or REM sleep, like deep sleep versus the non-deep sleep, and looking at how that changes following injury. We're seeing some interesting findings so far, but I can't really talk about them yet since they're really preliminary. But we're also trying to correspond or correlate that to the changes that we see in hormone disruption. So a lot of hormones are involved in sleep, and I talked about growth hormone. It has its highest release during slow wave or deep sleep. And so if we're having these hormone disorders, is it leading to changes in slow wave sleep, or is the changes we see following brain injury and slow wave sleep leading to the changes in growth hormone disorders? And so it's kind of like this relationship that we're seeing, bidirectional relationship really between growth hormone and sleep, and all of that is following brain injury. And we're just trying to get to the bottom of which one is causing which. And that's giving away all my research, but yes, that is what I'm doing.
Well, definitely love to have her on. I know that personally, in my own journey of concussions, sleep is absolutely affected from the moment I have a concussion for about 10 weeks. So I personally have seen that cycle happen. A couple people have asked. Oh, Hirsch?
Yeah, you were kind to offer me an opportunity to give an opinion, and this is really incredibly important work. One of the things that I'll add is that in addition to what they're doing now, the issue, particularly in adolescent teenage girls, is when during the menstrual cycle did the concussion occur? And it's sort of frustrating to us when we talk to clinicians. They don't even ask in their examination when the last menstrual period was before they do either baseline testing or post-concussion. And there's good literature to indicate that when during that menstrual cycle the injury occurs has a dramatic effect on all of the things that Bryce is investigating. And it's really an important area. And for Dr. Hewart and her work, it would be really important in her cohort of patients to go back and look at her data and see, as she's examining these young women, whether there was any attention paid at all to when during the menstrual cycle the traumatic brain injury occurred. And so it's a hugely important field, and Rachel and Bryce are doing really remarkable work.
That's awesome. Thank you for contributing that, Hirsch. And Jeff Bazarian's work at Rochester, and then also Ann Rasmussen, Ann's work at the VA, and they both have videos up on the Pink Concussions website, summarizing some of their work in under 3 minutes and less. So, and I have to say, we have about 7,000 women in our Pink Concussion support groups, and that is a #1 topic much of the time, because there's no other place where they can ask that question. It's hard to talk about your TBI at your gynecologist and then talk about gynecology issues at your neurologist. So again, it's what Johnny was saying, that cross section between disciplines. I think we are a few more minutes. There have been a couple of questions about any connections with diabetes and TBI.
Yeah, so that's another really prominent finding following injury, and I can't remember the name of this certain type of diabetes that occurs, and it's not type 1 or type 2, but it's a different type of diabetes that occurs in the period kind of quickly following brain injury. I see some clinicians shaking their head, where we do see like this sudden onset of diabetes following injury as well. And I think that's correctable. Like it's not as debilitating as the other types of diabetes, because it will eventually correct itself, especially if it's treated.
Well, and I think that's why I particularly like this topic, is because there's a test for it, you can rule it out, and if it's there, you can treat it. Like, huge.
Yeah,
so,
isn't that nice? Yeah.
There's not a lot of areas in brain injury that are that, hopefully 40 years from now we'll be there, but we're not there right now. I also had shaken baby written on my notes. Is there something else that we wanted to say about that?
We were just talking about if we had all the money in the world, what would we study or try to correct? And that was one of Mars. We're working with people at Phoenix Children's who we're trying to find ways to more readily or accurately or quickly identify whether an individual has presented to the emergency room with an abusive head trauma. And so, like one of the cases that we talked about where that child suffered from an abusive head trauma, and then came to the clinic later with these endocrine disorders. I mean, abusive head trauma occurs all the time. It's a really sad issue. It's a lot of times in these pre-verbal kids, and so they're not able to say what's happened, and sometimes you get false reporting, or you don't, or the parent or the caregivers don't know what happened to the child. And so we're just trying to find factors that will help us more easily identify whether an individual has suffered from an abusive head trauma, to try to, you know, treat it, but also like make sure that the situation that they're being released back into is okay for them to go back to that same situation. Because if abusive head trauma gets missed, I forget the exact number, but there's this really high likelihood that they'll eventually that they'll be abused again, and that the next one could lead to like death. And so it's just really important to try to capture these times when a child is presented to the emergency room with an abusive head trauma. There's really great people doing really great work on that topic as well. I'm thinking of Rachel Berger from Pittsburgh, and we're doing something here in Arizona as well to try to look at how we can try to help this abuse epidemic that is occurring all around us. So it's a silent epidemic, really.
Well, I so appreciate your time. And what the audience doesn't realize is I get to talk to all my guests for an hour before the show. So these were the notes that we took. So you were fascinating yesterday to talk to, you're fascinating today, you know, and you're the kind of person I would follow around and talk to at a conference. So it's really great to have had time. Again, these conversations are supposed to simulate the conversations we would have if we were at conferences. And I just did want to share that I finally have up all the videos. I had to learn how to make a thumbnail. I had to watch at least 4 videos by 18-year-olds explaining how to do a YouTube thumbnail. And thanks to the under 20 population, I was able to complete and upload my Zoom videos to YouTube. So that's there. There are also, some of them are on IBIA and NABIS. Thank you everybody for spending an hour with us. And next week we'll have Karen and Paul from Canada on DVI, their conference on domestic violence, interpersonal violence. And then we have Willie Stewart from Scotland and Hugh Williams from England. So thank you everybody, stay safe, and thank you, Bryce.
Awesome, yeah, thank you, bye.
Take care everyone.